Okay, well, good evening, everybody. Welcome, welcome. Thank you for coming tonight. I am going to start this presentation here. Okay, so tonight I'm talking about iridology and assessment tool. And my name is Brenda Generali. I am president and CEO of Joyful Living Services. I've been approved as a sanctioned school with the International Iridology Practitioners Association. I'm a certified comprehensive iridology instructor and iridologist through IPA, and a certified nutritional consultant through the American Association of Nutritional Consultants, as well as a member of the Guild of Naturopathic Iridologists and member of the General Naturopathic Council. There's my website if you want to see what's going on, my email, iridologynetzero.net, and my phone numbers. And let me see. So first of all, I want to thank you for being here tonight. I really appreciate it. I know there's a lot of other things that you could be doing, and I'm grateful that you are here. And one of the first things I need to do here is go over the disclaimer. So Joyful Living Services cannot be held liable for any misuse or malpractice of any techniques taught within this webinar, nor for any injury, suffering, or distress caused by students undertaking the techniques discussed. All students must accept that they are wholly responsible for their actions relating to the practice of iridology and must adhere to the relevant laws in their country and state of residence. Students are responsible for ensuring that they have appropriate insurance for practicing in their country and state of residence. Joyful Living Services cannot be responsible for any advice given by students to members of the public. Students must adhere to their local laws regarding the requirement for registration and/or qualification as an iridologist before suggesting supplements or offering nutritional advice. So let me explain a little bit about myself. My path to iridology began in 1983 when I had my own health issues. I was extremely stressed and had a lot of digestive issues. And a friend of mine suggested that I see an iridologist. So I did, had good results, and started sending friends to this iridologist who also had good results. One day I said, well, you know, I'd like to learn more about iridology. How do I find out? They sent me down to Dr. Jensen's. He just so happened to be teaching a class. I signed up for the class. That was in 1989. That was August of 89. I realized that next month it's going to be 32 years that I've been involved with iridology. So iridology has been my passion all this time. At that time, I started my career in iridology, and which led me to develop Joyful Living. And it's been my mission to help others improve their health. In 2018, I became a member of IPA. And as I said, I'm an instructor for them. And I see clients all over the world with the internet, which is wonderful, and do a lot of remote iridology. I've just opened my new office in Auburn, and I love it. And I have clients that come. And my future goals are to write a book called Iridology, The Path to Joyful Living, and to complete my fellow, among other things. I have all kinds of things that I want to do. So let's look at iridology. What is iridology? So this class is all about using iridology as an assessment tool. So what I'm going to do is I'm going to go over what iridology is and how we use it, how we see it. And then I'll talk about some of the signs that we can see in the eyes, and then I'll talk about some of the tools that we can use. So iridology is the study of the color and the structure of the iris of the eye as it relates to the genetic predisposition and health of the body systems. We are looking for genetic predispositions that are coming in both from the mother and the father side of the family. And by looking at the iris of the eye, we can see these genetic tendencies. And by learning about these genetic tendencies, you can learn what you should eat, drink, what type of exercise you should do, supplements, lifestyle, anything else that'll help you live comfortably in your body. Iridology does not name any diseases, but it does show us what areas need nurturing or what body systems need strengthening. Some of the things that iridology can show us, it can show us inherent strengths and deficiencies of organs, glands, and tissues. the potential ability of an organ to react to illness, familiar patterns of various syndromes and pathologies, and certain foods that a person could have difficulty digesting or utilizing. It can also show us areas of the spine that can have subluxations, potential central and autonomic nervous system imbalances, potential circulatory disturbances, potential connective tissue weaknesses, potential for glandular deficiencies, and potential for high uric acid levels, serum cholesterol levels, and lymphatic congestion. Now, there are a lot of things that iridology cannot show. So, for instance, it cannot diagnose or give the name of any disease a person may have or have had or identify pathology. That is for doctors. Iridology cannot do that. We do not do that. It cannot determine if a person has had surgery, and it cannot indicate precise blood pressure levels. That's for a blood pressure cuff. It cannot determine if a person has parasites or indicate the presence of yeast. However, I will say that there is an edit to that, in that we can see the potential for parasites and yeast in the sclera by looking at the sclera. It cannot confirm the presence of viruses, germ life, or bacterial invasion. However, we do know that we can find that out by using the Zytobalance, which scans the body for stresses, and that can confirm viruses and other things. It cannot determine if a woman is pregnant or has had an abortion, or indicate whether a tumor is present or what size it may be. However, there again, we can see what's called encapsulation signs in the sclera. And if we see encapsulation signs, then that can show us the possibility of maybe a tumor present, or a ball of infection, or a ball of parasites, things like that, areas that need attention. And it cannot show whether or not a person has kidney stones or gallstones. Also, it cannot show us give us the exact cholesterol or uric acid levels in the body. That is for a blood test. And it cannot determine whether or not hemorrhage exists, where it is located, unless it's located in the visible layers of the eye, so the conjunctiva and the sclera. It also cannot show if arteries are blocked or hardened, though we can see a potential for this in the sclera. And it cannot distinguish the gender or age of a person, predict a person's lifespan, or impending time of death. A few other things: it cannot show if a person needs surgery. It cannot locate a specific tooth that may be problematic. There again, the Zytobalance I'm finding is very accurate with that. It can't show if a person has ingested poison or been bitten by a poisonous spider or snake. Lots of things it can't show us. Okay, so legal wording, this is very important. It's something I emphasize to all my students. Iridology does not diagnose, but instead it analyzes or assesses predispositions and genetic inheritance. We are not medical doctors, and it is illegal to diagnose in the United States. We can go all around it and say what types of markings that we see that could be tendencies towards that problem, but we cannot diagnose. And when we look at the eyes, it's very important to look at the eyes with reverence, honor, and respect. Because when you're looking at the iris of the eye, you're looking at a person. You're looking more than just at the eye, you're looking actually at who the person is, emotionally, their personality, what they're going through. And a lot of times when you see somebody, they're going through a hard time and they need help. And so you want to really be respectful and honor that person. And so everybody in IPA, we're very dedicated and really concerned with the interests of all who we come in contact with in iridology. So let's look at some iris signs. Here we have 3 colors of eyes. And so, in the past, and when I say the past, 32 years ago, we used to believe that there were only 2 colors of eyes. There were blue eyes and brown eyes. And now with all the interracial mixing, we have mixed eyes. And each one of these color eyes has different genetic tendencies. So for instance, the blue-eyed type person is going to have more respiratory lymphatic. So lungs, chest, bronchioles, sinus, everything having to do with the blue-eyed personality. Okay, a mixed-eyed person is going to have more of the digestive type weaknesses. So liver, gallbladder, colon, stomach, pancreas, intestines. Okay, and then a brown-eyed person is going to have more of the blood and bone, anemia, those types of things. Okay, and of course, a mixed-eyed person, because we're mixed, we can have both the blue and the brown. And we usually, with the mixed-eyed person, there's usually a lot of orange, a lot of brown, yellow pigments that show up in the eye with a lot of the blue, this blue pigmentation underneath. So when we're assessing, since this is a class about using iridology as an assessment tool, one of the first things that we look at is we look at the zones. So the iris is broken down into 7 zones. And you can see here that the zones start in the middle next to the pupil. So this is the pupil. And you have a ring here, right here that goes around. This is called the collarette. Inside this ring is the digestive system. So we have the stomach and the colon inside here. So that would be zones 1 and 2, digestive and intestinal. Then we have zone 3, 4, 5, 6, and 7. Zone 3 is called the humeral zone. That has to do with the blood that goes in and out of the intestines, okay, in and out. And then zone 4 has to do with the muscles, 5, the structure, 6, the lymph, and 7, the skin. So whenever we see any kind of markings in the iris, depending on which zone it's in, this can tell us a lot about what could be causing issues with that person. And this is my eye, and you can see all these lovely rings that go all around here in the eye. And that is the reason that I got involved in iridology, is because notice how dark my digestive system is. Okay, this is where a lot of my issues have been in the past. And if I go back to doing the things that I used to do, I will have those problems again. And then, of course, this has to do with stress and anxiety, which I was very highly stressed when I got involved in iridology. And you can see that these rings are in zones 3, 4, 5, 6, and 7, which means all of these areas in my body could be affected by stress. So lots of stress, big reason to get involved in iridology. And I've learned a tremendous amount about my body over the years. Iridology is an amazing tool to learn about your health. It's an amazing tool. Now, one of the things that's changed in iridology is talking about the body is, and talking about it if you have a strong constitution, a medium constitution, or a weak constitution. So we used to do that. And now what we do is we talk about resilience. Resilience means how resilient your body is. Okay, how resilient you are to disease. How well do you bounce back from illness? Okay, so a very resilient, we have very resilient, we have resilient, moderately resilient, and least resilient. So when we're doing an assessment, we're looking to see how straight these fibers are in the iris. Okay, how straight they are. And if you see this very resilient iris, the fibers are very, very nice and tight and very, very straight, not a lot of space in between them. The resilient iris, not quite as straight. You can see that there's some more wavy fibers, a few little holes here and there, not quite as resilient. Moderately resilient, you see there's a lot more space. Okay, a lot more space, more of these lacuna here. And the least resilient, lots and lots of space between the fibers. Okay, so what that means is that somebody that's very resilient, they're going to bounce back better from illness. Okay, they're going to bounce back better. They're going to, it's going to be easier for them. They're more resilient. Okay, they're more resistant to disease. Whereas somebody that has this least resilient constitution, they are going to have a harder time. It's going to take them longer to get over illness. They're going to catch colds easier. Okay, they're going to get sick easier. Okay, so this is what we, one of the things that's really important. And this is really important in determining if somebody should go on a detox, because somebody that's very resilient, they are going to do better on a detox, a strong detox, than somebody who's least resilient. Somebody that's least resilient, you put them on a strong detox, they're going to get sick. Okay, whereas somebody that's very resilient, they'll be able to take a strong detox. Okay, so let's look at some of these markings here. So here we have what's called radial fibers or trabecula. And the fibers start at the pupil here, right next to the pupil. This is called the pupillary border. And right next to this, you can see the fibers. They start here at the pupil and they go out laterally, radially. They go out radially from the pupil out to the perimeter of the iris. And there are millions and millions of these fibers in the iris. And what's really amazing about this is those aren't actually fibers. Those are actually blood vessels. So if you think about your wrist and think about people that get carpal tunnel syndrome. Okay, carpal tunnel is inflammation of the nerve, oh my goodness, I just spaced on the words that I'm looking for. The sheath. Okay, you have a myelin sheath that goes around the nerves in your wrist. And with carpal tunnel syndrome, that sheath gets irritated and inflamed. And when it gets irritated and inflamed, it causes pain. And the person's hand hurts, it'll get numb, they'll get pain all the way up their arm. Well, these little fibers or these little blood vessels in the iris are all surrounded by the same sheath. It protects all of these blood vessels in the iris. There are millions of these little blood vessels surrounded by this same type of sheath. That is amazing that there can be all of these nerve fibers in here. And that's what we're looking at. We're looking at these blood vessels in here, and we're looking and seeing what they're doing. Okay, and that is how you get the nerve impulses from the different organs, from the parts of the body. They go in, they go up the spine, into the brain, cross at the brain, and then go down into the iris. And that's how we can see the reflex, what's going on in the body. So let's talk about a couple of these signs. So here we have, this is my son's eye here. Here we can see a lacuna where the arrow is. And you can see here where this arrow is that I have enlarged the picture. So you can see that these are all lacuna here. They're called lacuna. And these are areas where blood doesn't, these are areas that blood can't enter real easily, exit real easily. They're areas that they actually, toxins aren't released and nutrients aren't absorbed as easily. And so these are areas that we need to work on. These are areas that need nurturing, very important. So all of these areas here that are showing up in his eye are areas that aren't eliminating toxins or absorbing nutrients as well as other areas could be. Okay, so these are areas that need to be paid attention to. And here we have what's called a circulatory ring. I have seen this on pretty much almost everyone. You know, I would say 99% of the people that I've seen, they have this ring on the outside of their iris. This ring can be blue, it can be kind of a purplish color, it can be bright blue, it can be a little bit darker. It's on the sclera, which is the white part of your eye. And this shows us the possibility that there can be a lack of circulation, can be problems with numbing in the extremities. Hands and feet can be numb. There can be neuropathy, lack of exercise. If there's a lack of exercise, a lack of oxygen, lack of iron, all of those kinds of things. So it has to do with circulation to the extremities. Notice it's on the outside of the skin. And so it has to do with circulation to the extremity of the body. These are contraction burrows, and of course, this is my eye. And what we do is we count these rings. You know, when you go into the forest and you look at a tree that's been cut down, you count the rings that are on that tree, and that tells you how old the tree is by counting those rings. Well, in the iris of the eye, we count the rings, and that tells us how much stress or how much anxiety a person may be experiencing or has experienced. And these are genetic. They never go away. They do calm down. So when somebody is relaxed, they will calm down. When somebody is highly stressed, they will get bright whites and they will calm down. You know, some people think, well, if they take a lot of Bs, they'll actually go away. If they take a lot of B vitamins, B complex, they'll go away. But they never go away. They are genetic. These are my eyes. This is my eye. And I can tell you that both my parents have the same rings in their eyes. They're just a little different, but they have the rings. And they are definitely genetic. It's caused by the pupil. Notice the word contraction burrows, contract. So what happens when you have a lot of stress is the pupil can contract and expand and contract and expand very fast, and it can create those cuts. It can create those furrows. And so, of course, remember what I said about the reason I got into iridology. I was at the point where I couldn't eat anything. I was eating baby food, and I was so stressed I couldn't lay flat on my bed. I was breaking out in hives. I was about, my stomach was a disaster, and I was on the edge of a nervous breakdown. So lots of problems. And, you know, my life is completely different than it was then. And thank goodness. Thank goodness I found iridology, or who knows where I'd be. Who knows where I'd be. Chiropractic, massage, changing my diet, changing my outlook, changing my life. You know, everything has made a huge difference for me. Okay, cords. So cords, we do see cords. This is a cord here at the bottom where the arrow is, and I've got a larger picture here. It looks like somebody took their finger and kind of squeezed the fibers with their fingers and made a cord. And when we see cords, they're usually white like that. That has to do with inflammation. So usually when we see a cord in the iris, that can tell us where there can be irritation and inflammation in that part of the body. I can't see the chat right now. I'll have to wait to answer your questions at the end. Just remember your questions. Okay, so now let's talk about the funnel. This is my son's eye, and this is his right eye. And I've got an arrow right there at that funnel. A funnel opens right here. This is the intestines here, and the funnel opens and goes, it swoops out into what's called the ciliary area of the iris. And I wrote down here brachial plexus injury because when he was born, he got stuck in the birth canal, and the doctor had to pull him, and he twisted his neck, twisted his head. And when he did that, he twisted and pulled, he sprained the brachial plexus nerves that go from the neck and they go down the arm. And so he was paralyzed when he was born. Now, what I used to think before in iridology is we used to believe that these kinds of signs showed up when there was an injury. And what we've learned since then is this was genetic. So he already had this funnel in his eye, this area of his body, which happens to be his right shoulder. And this is where his injury is his right shoulder. He was already in utero, he already was weak in this area. And so even if he had been born cesarean, it wouldn't have mattered, because maybe later on he would have been playing soccer, maybe somebody would have hit him, he would have fallen, he could have got hurt as a kid, and then he still would have had a problem. It may not have been brachial plexus injury, but he still would have the weakness in that right shoulder. So what this is this is a weakness in the right arm and shoulder. And we went through so much physical therapy with him, and so much, a lot of Reiki, a lot of physical therapy, chiropractic, massage, worked with him for years, and he's almost normal, just a lot of body work. And, if you saw him today with a shirt on, you can't tell, that he has a problem, but that is something that he will always have to work on because it is genetic. He'll always have the right side it always takes more work to build those muscles than the left side, because those nerve impulses from the brain into the brachial plexus, he doesn't have the signals. And so that is really what changed my mind about iridology. That's when I moved from the old thought in iridology to the new thought in iridology. That's really what changed, is when I realized and I learned. And that kind of brings up the question, what came first, the chicken or the egg? That's kind of where well, what came first? Was this funnel there first? Or did he get injured and then the funnel showed up? And then as I learned about, how the iris is genetic and the sclera actually changes, once I learned that, then it all made sense. That injury was already there. Well, not the injury, but that genetic weakness was already there. And then he just, when he was born, there was the injury, and that's where it is. So something to think about, when we see markings in the eyes, that really tells us a lot. And that's what we're looking for. We're looking for those genetic tendencies. And that's his. That was his genetic tendency. Okay, lipemic diathesis. Lipemic diathesis. So this is a yellow, more of a yellow genetic diathesis. And this has to do with cholesterol and triglycerides, HDL, LDL, has to do with high blood pressure, low blood pressure, all those kinds of things. And it can be white, can be a white ring. It shows fats in the blood. It shows fats in the body might not be broken down by the liver, gallbladder, and so on. So just because somebody has that ring doesn't mean that they have problems. Okay, we have seen people that have that ring, and then when I ask them, do you have high cholesterol? Do you have high blood pressure? Do you have high triglycerides? Do you have, low HDL? And so on, then the blood tests come back normal. But most of the time when we see that ring, it does show us that there are issues. It is genetic. It is a genetic marking. It is a corneal sign. It is not an iris sign. It does not go away. So once it shows up, now it usually does get thicker and darker as people age. So a lot of times it'll be almost opaque when somebody's younger. And then as they get older, it can get thicker and wider. And notice this one is more yellow. So usually yellow it comes from kidneys. So we know in looking at that this person needs to work on their kidneys. If we see this sign under with somebody that's under the age of 40, that's something that we really need to pay attention to, make sure they have the blood tests and we find out what's going on. And, it's also an indication of MTHFR. And so, we always check the liver, make sure the liver is methylating, which is really important to see if there's any gene errors. So very important. Okay, pigments. Pigments, there can be yellow pigments, there can be orange pigments, there can be brown pigments, there can be rusty pigments, there can be black pigments, there can be kind of a bright orange pigment. All of these pigments mean different things. So yellow pigments usually has to do with kidneys. Maybe the kidneys aren't filtering properly. Orange can have to do with enzymes. If somebody doesn't have enough enzymes, it can also have to do with blood sugar, low blood sugar, high blood sugar. If somebody has brown pigments, it can have to do with the liver and the possibility of not methylating properly, possible MTHFR. And black pigments, that usually has to do with a possibility of something serious going on. So we always pay attention to pigments. We look at the pigments, we look at the color, we look at where they are, we look at how large they are, how small they are, and all of these different things, and they all mean different things. So real important to follow pigments. Normally, pigments don't go away out of the iris. Normally people, as they age, they get more pigments. I have seen pigments leave the eye under certain occasions. I did have a lady years ago that I put her on a cleanse and the pigments left her eye. But most people, we just see the pigments, they get more pigments as they age. Here we have what's called a Scurf Ring. It's really pretty. It's really beautiful. You can see this by, if you watch television and you watch a commercial with somebody putting on mascara or eyeliner. And if you really pay attention, you'll see that most of the models have this dark ring around the outside of their iris. It almost looks like they took a liner and outlined the the outside of their iris. And if you look at the picture that I've enlarged, you'll see that what it really is this is a thinning of the iris fibers in that part of the iris. So this is genetic. We used to think that if you skin brushed for a year, that ring would go away, but it doesn't. It's still good to skin brush because, of course, that is showing up in zone 7, and zone 7 is the skin. So that is telling us maybe that the possibility there could be some genetic tendencies there for the skin. Maybe it's not eliminating as well as it should. And so dry skin brushing, of course, will help. So, but it is genetic. It is a genetic marking. It doesn't go away, and it is showing us, and you can see in this picture over here, that the fibers are thinning in the iris itself. So what we're seeing here is we're seeing the lower layers. There are 4 layers in the iris, and the very bottom layer is black. And so that's what we're seeing here, is we're seeing one of those lower layers. Tophi, we used to call tophi a lymphatic rosary, and I've shown you here, I've made put an arrow here to one of these little tophi, but these look like little cotton balls, and they go all, they go around the eye. All blue-eyed people have these tophi. They can be white, they can be yellow, they can be orange, they can be brown, they can be multiple colors. And everybody has them. This has to do with the immune system. And if they are in a blue eye and they're more yellow or orange or brown, they can be showing us a little bit of toxicity. And so there again, we need to look at, lymphatic massage and detoxing and, all those kinds of things, and see what's going on. Maybe the person's not moving the lymph, they have lymphatic stagnation, things like that. And you can see, we can have these, we can see these in a blue eye and in a mixed eye. We can't see them in a brown eye. It's very hard to see them in a brown eye, but we can see them sometimes, but most of the time we can't see them in a brown eye. We just see them in a blue eye and a mixed eye. It doesn't mean they're not in a brown eye. It's just that we don't have the equipment usually that we can see that. Okay, here are transversals. And transversals are when you have a fiber that's kind of gone crazy. It's gone askew, and it goes across it'll go across the grain. It'll go across all the other fibers. As you can see here, this one, you can see this one here is going across. These are all going across. And usually that shows us a tendency for pain or inflammation in that part of the body. A lot of times this will show up in the back. If somebody's had an accident, somebody's had whiplash, it can show up in any of those areas. If somebody has had surgery, it can show up, because these can actually show up because they do show irritation and agitation. Okay, so let's talk about the pupils, because pupils are a really important part of an iridology assessment. And with the pupils, when we look at the pupil, what we're looking at is we're looking at the spine. And so I've got this chart here that shows you here on the left, it's color coded. So up at the top of the pupil, this has to do with the cervical spine. You have 7 vertebrae, and it starts with the atlas, which is C1, and it goes down to C7. This is in your neck. And then the yellow here, this is for the thoracic spine. You have 12 vertebra, and here's T1 through T12. Then you have the lumbar spine, which is the low back. You have 5 vertebra. So here's L1 down through L6, L5. Then you have the sacrum, which is at the bottom, and the coccyx. And here you have S1 through S5, coccyx and the tailbone. And so when we see any kind of flattening, sometimes, the pupil's not perfectly round. It should always be perfectly round. If it's not, if it's flat on one side, we can tell where there could be possible subluxations in the spine, and that could be causing issues in the body. So very important to look at the pupil. And there are other things that we look up as well. So here we have a large pupil. When the pupils are large, it's normal for children to have large pupils, but adults should not have large pupils. Their pupils should be about, around in this area here, about a third. And so if the pupils are large, it usually has to do with adrenal fatigue. It usually has to do, sometimes it can be medications. It can have to do with the person just be burnout, just burnout, adrenal fatigue. And if somebody spends a lot of time in a dark room, then the pupils can kind of remain larger. And so, when they go out in the light can hurt their eyes. The bad thing about having large pupils is it lets in too much light. So when we take a picture of the eyes, those pupils should contract. And so if they're not contracting, that can let in too much light, and that can cause problems with the nervous system. And so we need to make sure that those pupils contract the way they should. The opposite is true with really small pupils. So here we have the opposite. You can see very tiny, tiny pupils. Usually when there's very tiny pupils like this, a person is very uptight inside. Sometimes medications, medications can cause pupils to become very small. There again, it's a problem because when the pupils are very small, they're not letting enough light in. And that can cause problems also with the nervous system. And then, of course, we can also have what's called unequal pupil diameters or anisocoria. And with that, you can see there are both pupils. There are two different sizes there. The one on the left is a little bit smaller than the one on the right. Or opposite, if you're looking at it, it'd be the one on the right that's a little larger, but the right iris has a smaller pupil than the left iris. And so in that case, you've got one eye that's taking in too much light and the other eye is not taking in enough light. And that is confusing to the nervous system. That can cause irritation to the central nervous system, and it can manifest as nervousness, anxiety, and fatigue. Now, the nice thing is that these are all correctable. They're all correctable. I've seen them correct. So it can be correctable. So that's good. We can also see what's called hippus. And hippus is when the pupil pulsates. So when you shine a light into the eye, the pupil should stop. It shouldn't pulsate like this. And I've only seen this once. And it does catch your attention when the pupil pulsates, because you shine and you can see this if you get in front of the mirror. When you get in front of the mirror, your pupil should stop. It shouldn't pulsate like this. If your pupil pulsates, then that is doing exactly what I said. It's allowing too much light in and it's stopping the light. And it's so that constant swing back and forth, it indicates a disturbed synergism between the sympathetic and the parasympathetic nervous system. And that can lead to a rapid consumption of strength. Shattered nerves. Okay, people swing back and forth with physical and psychological traumas, and it can manifest into nervous conditions. So really not good to have pulsating pupils. So now let's talk about sclerology. A lot of people are interested in sclerology, and this is also something that iridologists use as part of their assessment tool. I like sclerology because it verifies what I'm seeing, what's going on in a person's body. And it is basically current information. So where iridology is genetic, sclerology changes. Okay, so we can see by looking at the sclera, and the sclera is the white part of your eye. By looking at the sclera, we can see what's going on right now. We do see some genetic markings, but we also can see what's going on right now. So, if this person was perfectly healthy, their scleras would be white. There wouldn't be any of this blue, there wouldn't be any of this yellow, none of this pink, these dark veins in here, they'd be very light. And so not only do we look for the colors that are showing up in the sclera, and that tells us certain things, we're also looking at these vessels. We look to see where they are, we look to see where they're going, and we look to see the shape. And that tells us many, many things about the body. Now, we can see from the sclera, like I said, if there's possible tumors, possible parasites, possible candida, those kinds of things. We can see circulatory issues. We can see if there's too much sugar in the diet. we can see many things that we can't see in the iris because the iris is genetic, but we can see those things in the sclera. And then the other thing we can see is we can see if there's healing. So if a program is working, we can see, as I saw today, with a client, we were able to see that at the end of those blood vessels, they start kind of disappearing. They get very light. And that shows us that maybe the detox is working, or changing the diet is working, or a healing is working. And so we can see changes in the sclera. And that's great because, you know, people want to know that the program that they're on is working. And so the sclerology can show us that. Okay, so if you're going to be an iridologist, or if you're going to see an iridologist, you're going to want to use the right tools, or make sure that they're using the right tools. So what kinds of tools can an iridologist use? And I'm going to be talking here about the tools that I use. You know, there are other iridologists out there that use other tools, but the first thing is a chart, you know, and want to use a current iridology chart. So this chart was created by Dr. Jensen, and most people know who Bernard Jensen is. And then it was revised by Ellen Jensen. So when he, you know, before he died, he asked Ellen, who's his daughter-in-law, to continue his research, which she did, and she updated the iridology chart. Now, you need to know that, you know, iridology has changed many, many times throughout the years. You know, a lot of people think that, you know, iridology, Dr. Jensen brought iridology to the United States, and that's all there is, but that's not true. Iridology is constantly changing. It is a science. And those of us, you know, all of us out there are doing research. Any of us that are doing clinical iridology, seeing clients, we're constantly doing research and learning how iridology is changing. So, you know, if you want to learn more about the history of iridology, you can go online and look it up. When I did research on that, iridology took me all the way back to King Tut. They found the first tablets for iridology in King Tut's tomb. So iridology started many, 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 many years ago. So, you know, you can go online and see all the charts as they've changed throughout the years, the different countries that use the different charts. It's amazing what you can learn. If you're interested in history, I highly recommend it. This is a sclerology chart that I use from Grand Medicine. If you're interested in sclerology and you want to learn sclerology, Leonard Melmer teaches sclerology, and IPA will be covering that. They will be taking that over later. They're not ready to do that yet, but this is a chart. And here you can see here in the center, this is the iris signs would be here in the center, and all of this on the outside here, this is all in the sclera. And so wherever we see those pretty colors in the sclera, or the blood vessels in the sclera, where they are, where they land in this chart, that can tell us where there can be potential issues, or what could be causing health issues. This is a chart that I use for all of my clients. It is a scale of thoughts and emotions, and it was created by Dr. David Pesic. This is a great chart in working with people with their health, because as we all know, under every physical illness, there are always unresolved emotions. And so in dealing with, you know, when somebody wants to improve their health, they first have to deal with their unresolved emotions. And so this is very, very important. And so I always work with this chart. I'm using the compass, the Zyto Balance, and this is a really great way to scan the body. This scans and it assesses stressors in the body, which is great because then we can see what's causing stress in the body and what those stressors, what parts of the body those stressors are affecting. And it's great because it can show us the spine, it can show us the teeth, it can show us the different organs and what's, you know, where these stressors are having impacts. If somebody's drinking enough water or not, if there are, you know, if there's possible parasites, possible MTHFR, possible yeast infections, candida, many, many different things can be learned by this scan. And it's very, very helpful. Like muscle testing, it does change. So if you scan somebody in the morning that hasn't eaten breakfast, they're going to come out with one scan. If you scan them again in the afternoon after they've eaten, their scan will be different. It's just like muscle testing, okay, because the body changes throughout the day, and so the scan will be different. And so it's important to scan people, on a regular basis, once a month. If you're working with somebody, it's good to scan to see if the program they're on is working, what's changing, and what's going on. Also, if you're going to take an iridology class, I know some people that are going to be listening to this, presentation are going to be taking the IPA core curriculum iridology class. Some of you have signed up for it already. And these are some of the books that we use in the class. And those are available on the website. Also, depending on if you're going to be doing iridology assessments or you are going to have an iridology assessment, depending on which tools people are using, they can use you can always use your own cell phone if you're not in a professional environment. I don't recommend a cell phone if you're going to be in a professional environment, because it's not professional. And if you are going to be in a professional environment, then I recommend better equipment. I use the SD804 and it takes good pictures, but there are other tools available. And also having a good 10x magnifying glass is important. And some people like to use transparent grids that you can put up on the screen. Some people like those. And then there are always flashcards that you can carry in your purse, in your briefcase, in your pocket, so that if you want to talk to somebody about iridology, you just pop them out of your pocket and you can show the flashcards. So these are some of the tools that I use, and that's me. That's at my house. This is how, where I used to see people, and my computer. So what I would do is put up the pictures, both pictures up on the screen, and go over them, use the charts. And this is my son. The little demo that I did, and using the magnifying glass with the light. And, I spent years using a flashlight magnifying glass before I got my first camera, and looking at all the little markings in the eyes. Now we have cell phones, and all this good equipment, so we don't have to use those, but those magnifying glasses are still really great. And there's my son again, and here I'm just demonstrating the use of the SD804 as a handheld. I don't use it as a handheld anymore because now I have the stand and I use it with the stand, but for quite a few years I've used it as a handheld, and it works just fine as a handheld. It takes really great pictures. So this is my new office, and so there's my daughter, and she is demonstrating. There's the stand, so she's got her chin in the chin rest, and her forehead in the forehead rest. And that's great because the person always has their head in the same place and their eyes are on the same place, and you can get good pictures. And I learned about projecting these pictures onto a screen when I went down to LA and saw a naturopath that I work with, and he was projecting the pictures up on the screen. And I thought, what amazing idea that is. So I'm projecting these pictures on a 50-inch TV screen, and you can see that's my daughter's eye that I had just taken, and you can see even from far away how good those pictures are. So if you are going to be having pictures taken, or you're going to be using iridology as an assessment tool, it's good to have good equipment. You'll get the results with what you pay for. And I've got my address there. If anybody needs to contact me, need to send me anything or make appointments, there's my new address, 1212 High Street in Auburn. And it's a great little office. I love it. This is a really great assessment tool. One of my students is a graphic designer, and she created these PDF documents. And each one, if you take the class, if you take the IPA class, or you have an iridologist do a reading for you, do an assessment reading, they will usually use these PDFs. And they are based on your iris color, They're based on the structure of your eye. They're based on the color of your eye. And so this is a great tool to use because my student Kier, she took the information from the class and she made these forms, and these are a great tool to use when working with clients. Iridology Station 5.2, this is a assessment tool that can be used. It's a scanning software that can be used that will actually scan the pictures for you. And it works really well and creates reports. And the new Iridologist is a software program that it's kind of like a dictionary that has a lot of information that you can use when you're seeing clients, if you're going to be using Iridology as an assessment tool. And the Nutribase software, when clients come to see you or you go see somebody, you always want to know what to do. What should I do? I have this problem, and now what should I do? And so the Nutribase software is a really great database for, to help you figure out, what types of herbs, what types of vitamins, what somebody may need. If you're interested in learning sclerology, Leonard has a book called The New View of Ancient Art Sclerology Manual, and it's in various languages. And if you're interested in doing animal iridology, there is Equine Iridology, where you can use the handheld camera, take pictures of the horse's eyes, and there are charts and courses for equine iridology. There's also canine and feline iridology. So if you're interested in working with dogs and cats, you can learn equine and canine iridology and perform that for your clients, or for yourself, for your own animals. So there are all kinds of tools that are available for iridology. So I have 2 upcoming events. This Saturday, I'll be at Sunrise Natural Foods, and I will be offering 30-minute iris assessments for $50, and then doing body scans separately after that. So if you are in the area, anybody that is interested in having a quick scan and a quick iridology analysis, that is something. This is wonderful because before COVID, I was working in the health food store once a month. And then COVID hit, right? And I couldn't go anymore, and the health food store couldn't allow it. And now we're able to do this again. So it's wonderful. It's a great way to, get the information out to the general public and to, offer the service. And I do have a class coming up next month, August 17th. That's the IPA core curriculum class that runs Tuesdays and Thursdays, either from 8 to 10 or 5 to 7. Some of you have already signed up that are in this webinar, and I know some people are interested in signing up. So if you are interested, there's the link, and you can talk to me about that. Thank you very much for being here tonight, and let's see if there are any questions. Okay, so now I can hear you. Hello, everybody. Let's see. Some questions. I believe it works, but not for some. Oh, that's the sound. Does that mean not everyone has the rings, stress rings, when they are highly stressed, if not passed down genetically? No, not everybody has stress rings. So that was a question that Kristen asked, but I don't think she's here now. Not everybody has stress rings. Stress shows up in multiple ways in the iris of the eye, but not always with stress rings. Okay, does anybody else have any questions, any comments? You'll have to unmute yourself.
Thank you. That was great information.
Lynn?
Great information. Thank you. Did you hear me? No.
I can't hear you if you are.
Well, this is Faith. I just wanted to thank you for all of the wonderful information that you shared with us tonight.
Something's going on with the sound. I don't know what's going on with the sound. If you have questions, go ahead and type it into the chat. For some reason, I don't know, I can't hear anybody. Oh, what's going on? Oh, you're welcome, Lynn. You're welcome. You're next. You'll be going into that IPA exam soon. We're looking forward to being able to, Lynn is a student of mine and will be happy. She passed level 1, level 2, and now she'll be going into the IPA exam soon. So we're looking forward to you passing that exam and being able to call you a certified comprehensive iridology instructor. Yay. I will, and I'm excited. Yes, I'm excited for you. Okay, and Ava is a new student starting, and okay, I'm going to try to say your name again. Razamai. I'm not sure if I said it right that time, but she just signed up today for the class, so that's exciting. Very exciting. Okay, if there are any questions, any comments, you want to type them into the chat. Wonder why I can't hear it. Wonder if it has to do with that thing. How long is the August program? The August program, it's scheduled to go from August through December. The last part of it is on your own. You have to do 10 evaluations. So just really depends on how long it takes you to do your evaluations. And then there is, I have like 5 quizzes to kind of see where you are, if you need some mentoring or if you're good, and then you can go into the exam. So depending on, where you are, it may go into January, it may not. You may be able to finish by December. Did I say your name right? Razamai. Did I say it right? I'm gonna have to learn. I'm gonna have to call you Rosemary. That's it. That's all it's gonna have to happen. Okay. Any other questions? All right. Well, if no other questions, I hope that everybody has a wonderful evening. And if you have any questions, there you are. Oh, nice to see you. If you come up with any questions or need to talk about anything, you know where I am. You can reach me on Facebook or call me or email me, or you can reach me however you want. Okay. All right, everybody. Have a great evening. Thank you for coming. Bye.